Misinformation has always been an element of people's response to disease, particularly in an outbreak. We look at how irresponsible sharing of unverified information could harm human health or lead to unnecessary panic. CGTN'S Chao Mghono unpacks the story.
The scope and speed by which social media enables misinformation is unimaginable.
As a Chinese citizen and journalist, are you worried about the rise and escalation in anti-China racism as a result of this latest controversy?
It's the Western media reports. For example, Der Spiegel, one of the most circulated magazines in Europe. They have a headline that read this: the virus, regarding the coronavirus, a little racism is fine. And quote, thanks to the yellow-skinned slit eyes, that we may all be dead soon. And you have the Wall Street Journal, of course, calling China the real sick man of Asia. These are really concerning issues because now some Westerners are calling the coronavirus the China virus, but I didn't remember people calling Zika the Brazil virus or Ebola the Congo virus. So people need not panic. People need facts. People should look at it in an objective manner.
Misinformation and disinformation are problems when you have the outbreak of a disease. And the reason that is because for people to make the right decisions and access the health care they need in that moment, they need the correct information. And so when that doesn't happen, then their health and ultimately their lives are placed at risk. Before this outbreak of coronavirus, the world was dealing with a resurgence in measles because people had refused to be vaccinated over false information that the MMR vaccine was causing some harm.
With over 70,000 confirmed cases and no cure, many people are browsing the internet for answers. Unfortunately, more people are likely to share the wrong advice on social media.
We are really afraid. We do not even know if the state has put in place cells or appropriate measures in our hospitals to deal with possible cases of contamination. Besides, the populations have no information on this coronavirus.
So here is a story that ran in Lagos, Nigeria, and it was saying that Lagos had confirmed 9 cases of coronavirus and 4 deaths. But this story was actually lifted almost word for word from another one that was talking about Lassa fever. And so once we looked at this story, it was very clear to us that this would have been a massive event. If the government had asked a court for this permission, it would have been a massive event. People would have reported about it. But there's absolutely nothing about this in China. So this cannot be believed. So this was the picture that was manipulated, right, to show that he was wearing a face mask. And what that does is it can perpetuate racial discrimination.
Social media experts and health officials say efforts to guide users to verified sources on subjects can save lives.
It's important to note that because it's a very new disease, that a lot is still being learned about it.
As scientists predict more outbreaks in future, sharing unverified information remains a risk, especially during a global emergency. Chao Mghono, CGTN.